But I hope this is something you don't have to deal with, but if you do, at least you are aware of some signs and symptoms now. Hey, Eric Henniger here. I've been a practicing trial lawyer for 25 years now, and one of the areas that I focus on most is traumatic brain injuries, also known as TBIs. And I want to spend just a few moments talking to you about signs and symptoms of TBI in case you or a loved one suffers from such a thing. You know what to look out for, and then what to do if you suspect that you're suffering from a TBI. First of all, TBI, traumatic brain injury, 3 categories: mild, moderate, and severe. What I'm talking about with you today is really just the mild portion. Moderate and severe is much easier to deal with or diagnose. You'll certainly know if someone you know has those two. Mild, although it's not mild at all, but it really focuses on, think of concussion. You know, you talk about football players or soccer players or people in sports that get hit in the head. That's a concussion. That's a mild traumatic brain injury. And most people don't realize that. But the symptoms that you need to be focused on or be alarmed about are anything like persistent headaches. You may have some nausea, vomiting, light sound sensitivity where it just bothers you. There could be a ringing in your ear. Those are the things that you see most often. Now, there are a lot more. It could be psychological. So you have unusual amount of stress, or you are getting angry easier, or you're just in a bad mood a lot. Depression is also a portion of that. Another big issue that we see a lot of are sleep disturbances. And what we're learning now through science is how important sleep is. And when you have a TBI and it's disturbing your sleep, it messes with everything else in your body and it really throws you off rhythm. So those can be some pretty serious issues. Another thing that I've seen a lot in some of my clients has been vertigo. You get dizzy and you cannot keep your balance, and that causes additional problems such as nausea, vomiting, and just a general unease going through the day. So if any of those things happen, or you see those in yourself, or you see those in your loved ones or friends or family, I would suggest really quickly getting evaluated by a doctor. Get it checked out. If you have concussion, or most commonly known as after 30 days, it's called post-concussion syndrome. There's therapy you can do for that. There's some medications and there's some processes that you can go through to really help you get through that. So again, Eric Henniger, do a lot of TBI work. If you have any questions, please drop them in the comment. But I hope this is something you don't have to deal with, but if you do, at least you are aware of some signs and symptoms now.